On February 14, 2025, Pope Francis was admitted to Rome's Gemelli Hospital. The Vatican initially stated that the Pope was there for previously scheduled medical checkups. However, as days passed, it became evident that the situation was more serious. The Vatican's communication team, in an unprecedented move, began releasing regular updates on the Pope's health. This was a significant departure from the Vatican's historically tight-lipped approach to papal health matters. The updates painted a picture of a Pope battling a more serious illness than initially thought. The world watched with concern as the news from Gemelli Hospital unfolded. The Vatican's open communication policy, while unusual, was welcomed by many. It allowed the world to follow the Pope's health journey closely and offer prayers and support. On February 18th, the Vatican announced that Pope Francis had been diagnosed with pneumonia. This news heightened the concern of Catholics and well-wishers around the world. The world held its breath as medical professionals at Gemelli Hospital worked diligently to treat the Pope. Despite the seriousness of his condition, the Pope was said to be responding well to treatment. The Vatican shared that he was in good spirits, even managing to work and maintain some of his daily routines from his hospital bed. The Vatican's updates were a source of comfort for many, demonstrating the Pope's resilience and determination. Pope Francis's diagnosis of pneumonia came as a worry to many. Pneumonia, an infection of the lungs, can be particularly dangerous for older adults and those with underlying health conditions. Given the Pope's age and his history of health issues, including a colon surgery in 2021, the diagnosis understandably caused concern. The medical team at Gemelli Hospital acted swiftly, administering antibiotics and providing respiratory support. The Pope received oxygen therapy to help with his breathing. He also continued to work with his physiotherapists to maintain his mobility, a challenge he has been grappling with due to his knee problems. The Pope's condition began to improve gradually. The Vatican's updates indicated that he was responding well to the treatment and his breathing had improved. He was able to eat normally, and his energy levels saw an uptick. The Pope's resilience and fighting spirit shone through, even as he battled the illness. Despite the positive signs, the medical team at Gemelli Hospital remained cautious. They emphasized the need for the Pope to get ample rest and recuperation for a full recovery. The Pope, known for his tireless work ethic, continued to work on papal documents and stay updated on global affairs, even from his hospital bed. The Vatican's handling of Pope Francis's health has been remarkably different from the past. Historically, the Vatican has been extremely private about the health of the popes. Illnesses were often shrouded in secrecy, with minimal information released to the public. This time, however, the Vatican has chosen a path of transparency. Regular and detailed medical bulletins have been released, keeping the world informed about the Pope's condition. This approach has been widely praised, with many lauding the Vatican for its openness and honesty. This shift towards transparency can be attributed to several factors. Firstly, the modern media landscape demands instant and constant updates. Attempting to maintain secrecy in the age of social media would be futile. Secondly, the Vatican recognizes the genuine concern and affection people have for Pope Francis. Keeping the world informed is seen as a way of reciprocating that affection. This new era of transparency is likely to have a lasting impact on how the Vatican communicates in the future. It reflects a willingness to adapt to the changing times and engage with the world in a more open and direct manner. The news of Pope Francis's hospitalization sparked an outpouring of prayers and well-wishes from across the globe. Catholics and non-Catholics alike united in sending messages of support for the ailing pontiff. Social media was flooded with hashtags like #PrayForPopeFrancis, reflecting the global concern. Religious leaders from different denominations expressed their solidarity, offering prayers for the Pope's speedy recovery. World leaders, including President Joe Biden and Prime Minister Narendra Modi, sent their best wishes. The universal appeal of Pope Francis, a figure known for his humility and compassion, was evident in the global response. The Vatican's transparent communication played a key role in fostering this global outpouring of support. By keeping the world informed, the Vatican ensured that the Pope would remain in the thoughts and prayers of millions. The shared experience of anxiety and hope transcended geographical and religious boundaries, uniting people in a common cause. The Pope's illness, and the world's response to it underscored the powerful role he plays as a global leader. His message of peace, compassion, and interfaith dialogue has resonated with millions, solidifying his place as a unifying figure in a world often divided.